Hi, welcome to Human Health, where we dive deep into the medical topics to empower your knowledge about your health. I am Dr. Touheed Azeez, and today we are exploring about Ozempic, a medication that has been making waves in the treatment of type 2 diabetes, weight management, and more. You may have heard about it in the news, on social media, or even conversation of weight management or something called Ozempic vulva. In this video, we will break down what Ozempic is, how it works, its benefits, risks, precautions, and whether it is right for you. Plus, we will address that intriguing term Ozempic vulva. Let's get started. Ozempic, known as generically as Semaglutide, is a prescription medication developed by Novo Nordisk. It belongs to a class of drug called GLP-1 receptor agonists or glucagon-like peptide-1 analogs, which mimic a natural hormones in your body. Ozempic is primarily FDA approved for managing type 2 diabetes in adults to improve blood sugar control alongside diet and exercise, reducing the risk of major cardiovascular events like heart attack, stroke, or death in adults with type 2 diabetes and established heart disease, lowering the risk of kidney disease progressions, kidney failure, and cardiovascular death in adults with type 2 diabetes and chronic kidney disease. It is also used off label for weight management, though another semaglutide brand, Wegovy, is is specifically FDA approved for weight loss in patients with obesity or weight related conditions. Ozempic is administered as a weekly subcutaneous injection using a pre-filled pen, available in dosage of 0.5 mg, 1 mg, or 2 mg. It was first approved by FDA in December 2017 and has since become one of the most prescribed medication in the US with over 25 million prescriptions in 2023 alone. So, how does Ozempic works? Semaglutide mimic GLP-1, a hormone produced in the gut that regulates blood sugar and appetite. It works through three main mechanisms: increases insulin secretion when you eat. Ozempic stimulates your pancreas to release more insulin, which helps move sugar from your bloodstream into cells for energy. Reduce glucagon release. It prevents your liver from releasing stored sugar, keeping blood glucose level in check. Slow gastric emptying. Ozempic delays the movement of foods through your stomach, which helps you feel full longer and reduced appetite, contribution to weight loss. These actions lower blood sugar level, improves A1C, a measure of a long-term blood sugar control, and promote weight loss, why which is why it is effective for both diabetes and management. And in some cases, weight reduction and clinically trial like the sustained trials have shown that Ozempic can reduce A1C by 1 or 2% and lead to an average weight loss of 7.1 to 14.1 pounds in adult with type 2 diabetes. Before starting Ozempic, it is critical to understand the precaution to ensure safe use. Here are key considerations. Number one, contraindications. Do not use Ozempic if you or your family have a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. as studies in rodents shows a risk of thyroid tumor. It is unknown if this applies to human or not, but caution is advised. Also avoid it if you are allergic to semaglutide or have severe gastrointestinal issues like gastroparesis. Number two, pregnancy and breastfeeding. Stop Ozempic at least 2 months before planning pregnancy due to its long half-life of about 1 week. It is not recommending during it is not recommended during breastfeeding. Number three, hypoglycemic risk. When combined with insulin or sulfonylurea, for example, glimepiride, Ozempic increases the risk of lower blood sugar. Monitor your glucose level closely and discuss dose adjustment with your doctor. Number four, kidney and liver disease. Patient with severe kidney or liver disease may need alternative treatment as Ozempic's safety in these conditions varies by disease stages. Number five, surgery. Inform your healthcare provider if you are scheduled for surgery, as Ozempic's slowing of gastric empties may affect anesthesia or recovery. Number six, drug interactions. Ozempic can delay the absorption of oral medication due to slowed gastric emptying, so inform your doctor about all medications, supplements, or herbal products you are taking. Always follow your healthcare providers. Regular monitoring with blood sugar and urine tests is essential to track progress and detect side effects earlier. Is Ozempic effective? The answer depends on your health goal. But data is promising data is promising in clinical trials like Sustain, Fold, Ozempic significantly lowered A1C level by up to 2.2% at the 2 mg dose compared to placebo. It also reduced body weight by an average of 7.1 to 14.1 pounds, making it a valuable tool for patients with type 2 diabetes who are overweight. For cardiovascular health, a study with over 3,000 patients shows that Ozempic reduced the risk of heart attack, stroke, or death by 26% compared to placebo in those with type 2 diabetes and heart disease. Additionally, the FLOW trial demonstrated that Ozempic lowered the risk of kidney disease, progressions, and cardiovascular death in patients with type 2 diabetes and chronic kidney disease. Ozempic is not a magical bullet. It works best when combined with balanced diet and regular exercises. For weight loss, we go a higher dose. Semaglutide is preferred as Ozempic's dose are lower and not FDA approved for weight management alone. If you stop taking Ozempic, study shows you may regain about two-thirds of the weight lost within a year. So long-term commitment is key. Like any medication, Ozempic has potential side effects. The most common affecting more than 1 in a 10 people are gastrointestinal nausea, 20% of patients vomiting, 1 in a 10 diarrhea, about 1 in a 12 abdominal pain, and constipation too. These are usually mild to moderate. Worse at the start or after dose increases and often improve over time. To manage them, eat smaller, blend meals, avoid greasy or spicy food, and stay hydrated. More serious but less common side effects includes number one, glycemia, especially when combined with insulin or sulfonylurea, causing symptoms like shaking, sweating, or confusion. Number two, pancreatitis, severe abdomen pain that may radiate to the back, with or without vomiting, seek immediate medical attention. Number three, thyroid tumor. Symptom like a neck lump, trouble swelling, or hoarseness require urgent evaluations due to the potential risk of medullary thyroid carcinoma. Number four, gallbladder issues. Pain in the upper stomach, fever, or jaundice may indicate gallstone. Number five, vision changes. Rarely, Ozempic may worsen diabetic retinopathy or cause non-arteritic anterior ischemic optic neuropathy, a potentially blinding condition. The European Medicines Agency noted as very rare side effects in June 2025, like kidney problems, changes in urination, or swelling, may signal kidney issues. Allergic reactions like hives, swelling, or difficulty in breathing requires immediate care. Other reported effects included increased heart rate, 2 to 3 beats per minute, bad breath, and potentially tooth decay due to reduced saliva or vomiting. You may have heard the term Ozempic vulva and on social media or in the news. Let's clarify, this is not a medical diagnosis. It is a colloquial term used to describe perceived changes in the vulva or vaginal area in some women using Ozempic or other GLP-1 agonists. These changes like sagging or wrinkling of the vulvar skin, labia, or pubic mounds are not directly caused by Ozempic itself, but are likely due to rapid weight loss. Weight loss can reduce fat in area like the face, buttocks, or vulva, leading to a deflated or shagging appearances, sometimes called Ozempic face or Ozempic butt. In other contexts, some women reports vaginal dryness or laxity, which may mimic menopause symptoms, but these are not officially linked to Ozempic in clinical studies. These changes can occur with any rapid weight loss, not just from Ozempic, and can often be managed with lifestyle changes, pelvic floor therapy, or procedures like labiaplasty or labia puffing for cosmetic concern. If you are experiencing these changes, consult your doctor to explore treatment. Always consult your healthcare provider to determine if Ozempic is right for you or not, and never use compounded or counterfeit versions, which can be unsafe. If you found this video helpful, please like, subscribe, and share it. Drop your questions in the comments below and let me know what health topics you'd like me to cover in next video. Stay informed, stay healthy, and I will see you in the next video.